Dr. Shetlin, Certified Auto Accident Occupant Injury Specialist Physician. I hope you'll take just a brief moment and watch this valuable information on this short video.
The following is a brief explanation of why it is so important to co-care a patient following a motor vehicle collision, regardless of if it was high speed or low speed. Extensive human crash tests have been done where we've measured the physics applied to human bodies rather than crash test dummies. This Croft research and research from the Spinal Institute of San Diego found some of the following. I'll just show one of the videos. This is a crash test showing the closing velocity of the bullet vehicle, the vehicle about to do the rear ending, moving at 9.9 miles per hour, and the vehicle that stopped, when it's impacted, goes from 0 to 6 miles an hour instantly. That's the change of velocity. And the gentleman in the black car, his head is going to experience not only the change of velocity of 6 miles an hour, but g-forces of 13, meaning his head weighs 13 times its normal weight. In the split second, it's moving in the opposite direction of his body 3 times. Another complicating factor is that his head restraint was too low, acting as a fulcrum rather than a stopping point to keep him from hyperextending posteriorward. And you notice he was also injured and taken out of the study. There's no visible damage done to his vehicle, and this is important to note since oftentimes insurance companies will document, oh, if your vehicle wasn't injured, you couldn't have been injured. And the research clearly shows that there is no correlation between injury to occupant and damage to vehicle. So it's very important to have these things documented properly, and unfortunately most providers don't go to the detail necessary, especially for litigation in a case, and that's why a certified auto accident occupant injury specialist is so helpful to do a detailed exam going over the physics that the vehicle experienced as well as what the occupant experienced, and then prescribing care based on the research findings that are out there, and a lot of physicians are unaware of this. Biomechanics and the forces to the occupants, it's important to understand that the vehicle experiences one set of forces, the occupant actually experiences a different set of forces, or a more accelerated set of forces. For example, the acceleration curve for human volunteer tests found that if a car has a 8 mile an hour impact, it's going to have a change of velocity about 4.9, but the torso, the car's going to experience 2 Gs, the torso is going to experience 3 Gs, and the head's going to experience almost 5 Gs. So the occupant is much higher, we can see by these curves, versus what the actual vehicle experienced. It's very important to understand that just as in the medical field, physicians specialize in different areas, from emergency room to general practitioner to surgery to pediatrics to podiatry. In the chiropractic realm, the chiropractors typically are all bunched together in one fishbowl, but they're very different and they have their areas of specialty. And sadly, when medical doctors work with chiropractors and don't know these differences, they may not get what they're looking for or are hoping for or expecting when they refer a patient out. But to refer to a certified auto accident specialist after an emergency room visit or any kind of auto accident, it's a night and day difference where the certified specialists document clearly and communicate with the medical physicians, document clearly and communicate with attorneys, understanding the professional language that helps bridge the gap there, helping to build a stronger case and rehab the patient properly to full medical improvement. Can these forces cause injury even in low-speed collisions? Absolutely. And unfortunately, if we don't co-care and treat the patient right, it costs the patients financially, in the recovery and the prevention of chronic conditions, which is going to cause them pain and suffering and more financial stuff as they have to pay for things in the future rather than using the insurance that's there to cover it when they're initially injured, and legally, because if it does go to litigation, if their case goes beyond just getting better and they have to actually hire an attorney and do anything in court, if things aren't documented right, it just creates such a nightmare for that patient's case and is so expensive in the long run for them. There's a great deal of research and literature that shows the thresholds and the treatment protocols. Since the 50s, it's talked about how we are supposed to grade the injuries 1 through 5 and then dictate the care based on the grade of the injury. Most of them start with the physical medicines, chiropractic, physical therapy, massage first, and then as those, maybe an emergency room visit or something, and then these, and then it goes through a flow. If they're not getting better under those physical medicines, of the more aggressive steps we take before we go back to surgery. And this is very important for not only physicians to know and understand, but also for attorneys to understand. I want to thank you for taking just a few moments to go through this. If you have any questions, please feel free to give me a call. My number is 801-446-5100.